Hi, my name is Michael Varner. I want to talk briefly today about the purpose of my previous portfolio projects and to make a recommendation for improvement related to my findings. My patient had an existing diagnosis of COPD and had been admitted for a pneumonia exacerbation. With my mind map, I tried to accrue the expenses that would accompany this diagnosis. It included labs, room charges, IV therapy, O2 therapy, anything that I thought might be a part of this plan of care. Now, the estimates came from the CDC, WebMD, and also lab personnel from a local hospital. These expenses totaled to over $9,000, which is a huge amount in itself. However, in this scenario, the patient additionally obtained a hospital-acquired infection, MRSA. The CDC states that this can increase the cost to as much as $28,000 and increase length of stay to as many as 8 days. So where does all this fit in? Insurance companies are no longer paying for these hospital-acquired infections. Hospitals are going to have to start paying these costs. So what do? My recommendation is to educate the staff at length, audit the infections, and hold each unit accountable for increased infection rates. You're probably thinking, that's the number one thing that we educate on. Contact precautions, hand hygiene, we've heard it over and over and over. But we can always learn more. For example, a few months ago, I did a quick in-service over c-diff. I included a survey. One of the questions was simply, what's the preferred method for hand hygiene on a patient that has C-diff? 70% of the staff answered that alcohol gel was just as effective as soap and water, which is not the case. Literature shows that alcohol gel is not effective or adequate in killing C-diff spores. Instead, soap and water is the preferred method. The point is that we do need to continue with more education and keep an eye on infection rates. Thanks for listening.